Well, today is World Osteoporosis Day, and our sponsors at Sana Physical Therapy have a fitness series to help their clients work through the disease. And joining me now are Doctor of Physical Therapy, Rachel Clark, and her client, Carolyn, with more information on this fitness series and their other physical therapy services. Welcome, ladies. Thanks so much for joining me.
Hi, thank you for having us.
Of course. Okay, so we mentioned that today is World Osteoporosis Day. So I'd love it if you could explain to our viewers what osteoporosis is and how it affects people that have it.
Yeah, so osteoporosis is, it's Greek for porous bone, and it is when your bones become brittle, weak, and have the potential to fracture. This happens because bone is a living tissue, and it happens when the rate of bone breakdown exceeds bone growth. So this happens, it affects 10 million people over the age of 50 in the US, and that's with osteoporosis. And osteopenia, which is one level below osteoporosis, affects about 40 million people in the US.
Okay, wow. So let's talk about how physical therapy and Pilates actually helps benefits people living with this disease.
Yeah, so unfortunately, your risk is higher. If you're a woman, about 80% of those living with osteoporosis are women. And it comes on often during your menopausal or postmenopausal years.
As if we don't go through enough.
Right, exactly. So part of that is these bones become, weak and brittle, as we discussed, potential for fracture. So what we can do, so we can't change our age and maybe our genetics, but we can change is our physical ability to kind of change that. And PT is one thing that we can do to help support bone growth, help strengthen our muscles around our joints. That's what supports our bones. It works on posture, so posture awareness and strength, and the Pilates-based rehab and our Pilates line of service really focuses on strengthening that core, our scapular stabilizers to keep us upright and tall. One thing that osteoporosis does, it's kind of a silent disease, and what it does is it, because those bones are breaking down, especially in the spinal column, it causes us to stoop, yes, to come forward in our body, and then all of a sudden it's very hard to be upright again. So that's changes in those bones. We call this like a kyphosis or kyphotic posture, a dowager's hump that you see. And then it takes your center of mass away from what it normally is, so you have a higher risk of falling.
Okay.
And unfortunately, when you fall, you have a higher risk of fracture.
Right.
And in most people, that happens mostly at the wrist, the hip, or the spine is where we sustain those fractures. And statistically, those with osteoporosis have a 30 to 40% chance of an osteoporotic fracture in their lifetime.
Wow.
So what PT does is it works with you, at least at Sana, we work with you individually to really help prevent falls. So work on your balance, your coordination, your mobility, and your strength, kind of all in one, to prevent any of this from happening to you.
Nice. Carolyn, tell us a little bit about your story and how Sana's been able to help you.
Okay, thank you. I've been going there for a little over a year now, initially for physical therapy. And with all the things that Rachel has talked about, to me, the best part is the individual attention you get from the doctor of physical therapy. They work just with you for that time. And you're working on some of the Pilates equipment, but also on balance, strength, core exercises, all of that. And eventually, I graduated from physical therapy, and I now take Pilates classes where you're using more of the equipment. And I was mentioning no two classes are the same, despite you're using the reformer and some of the other things, whether it's the tower, the jump board, one of my favorites. Just all
Great
the
for
different.
bone building.
Yeah, well, I would do jump board all day if I could.
And do you feel like you've noticed a difference in your everyday life?
Definitely. I'm sitting better, straighter posture.
You have great posture right now.
And my balance is a lot better. You don't really think you have poor balance until you try to do some things and you realize, gee, I really don't have the greatest. But yeah, just the strength. And I think not being so intimidated by the diagnosis of osteoporosis, because it can be very debilitating for people, especially when you're not expecting it.
That's right. And Rachel, really quickly, I know that you have your Buff Bones Fitness Series coming up. Tell us about that and where people can go to get more information and sign up.
So Buff Bones is a medically endorsed fitness series focused on people with osteoporosis and osteopenia. And it is a series of resistance exercises. Carolyn's participating in it now, yep. A lot of transitions, a lot of weight-bearing positions that are done with this class, and it's run by one of our physical therapists, Erin Meehan, who's a certified buff bones trainer, and she's one of the only ones in our region, and I believe Sana is the only place that's offering this at the moment. So we currently have 3 classes going right now. They're full and booked, but we opened just yesterday on our website the classes that are going to be starting in December for that. So that's live and available for anyone to sign up. They're going so well right now. I'm so happy that we're able to offer that to the community.
Nice.
It's such a great group of people that are participating in it. And not to mention, men are very welcome to. 20% of men also have osteoporosis, so this is excellent for them as well.
A great series. Thank you so much for coming in and sharing your story and the great work
pleasure.
you're doing
Thank
at Sana
you.
to help viewers. If you'd like to learn more about our sponsors at Sana Physical Therapy, visit sanahealthandwellness.com or call that number right there on your screen. Thank you so much for coming in, ladies.
Oh, thank you, Chelsea.